Hi, I'm Wally Taylor from Forum Health Austin. Today, my topic that I want to discuss is the role of oxidative stress on heart rate variability. I'm going to start off by defining heart rate variability, and then I'll talk about how oxidative stress interacts with it, and I'll talk a little bit about oxidative stress and what it means to us in terms of chronic illness. First of all, the heart rate variability is a measurement that you can take that has to do with how regular or steady is your cardiac rhythm. Now, most people think that you want to have a very, very steady cardiac rhythm. Some people call that normal sinus rhythm. But it turns out that when we're normal, there's actually a slight variability in the intervals between our heartbeats. It's not a low number. If you have low heart rate variability, that's usually caused by some problem with your autonomic nervous system, usually related to oxidative stress. There's a number of different ways you can measure heart rate variability, but lately a lot of people have been taking advantage of monitoring devices like the Apple iPhone and the Oura Ring that's available, and some of these newer things that you can put on your body that actually measures it. Of course, it can also be measured using Holter monitors and some of the more sophisticated equipment. Now, when heart rate variability is abnormally low, this is potentially a sign of a problem, which often correlates with what we call oxidative stress. So oxidative stress basically just means that in your body, for whatever reason, you have an excess of these chemicals, also known as free radicals, that together cause oxidative stress. One thing that's really interesting is the fact that we have in our body, in many of our cells, we have what are called mitochondria. Some people know those as the powerhouse of the cell. Well, the mitochondria can be altered if the brain perceives danger in a process known as the mitochondrial cell danger response. And when that happens to the mitochondria, they actually shift in the way they metabolize fuels like carbohydrates, fats, and proteins. And instead of using oxidative metabolism that produces most efficiently the ATP, they can move into an altered form of metabolism, sometimes called anaerobic or non-oxidative metabolism. And when they go into that phase, they tend to generate a lot more of these free radicals, which contribute to oxidative stress. Now, oxidative stress, if we have too much of it, some people liken it to other forms of oxidation, such as, for example, when a car gets oxidized, the metal, it actually rusts. So it's a process of degradation, you could say. And when our bodies undergo oxidative stress, it leads to things like cancers and inflammation and excessive wear and tear on our joints and our bones. It can lead to lots of symptoms in the brain. We can have symptoms like memory loss and brain fog. We can have problems with our immune system not functioning normally. This is all related to oxidative stress, which is actually the final common pathway of most of the way our body responds to a wide variety of environmental threats, whether it be biological threats like viruses or mold toxins or chemical toxins or toxic heavy metals, even physical toxins like certain forms of EMFs like 5G and Wi-Fi, microwave ovens, and so forth. So heart rate variability is one way that we can kind of track our levels of oxidative stress at any time. Now, you need to know also that oxidative stress can come and go quickly, or in some cases, depending on what's happening to the body, it can hang around and it can be persistent. Now, in my practice, because oxidative stress coming from all of these various threats is such a big problem and something that we really want to focus on reversing, that requires that we do several things. First of all, we like to try to figure out what are the root causes that are triggering the brain to perceive threat, and we try to remove those. Whether it's mold toxins or heavy metals or toxic man-made chemicals, all of those things we would try to eliminate. And at the same time, we try to help the body detox those. Now, there is a substance that we make in our own bodies. It's probably the most important nutrient that I recommend to my patients in the practice that I have, and that's a molecule called glutathione. So it's actually a tripeptide, or a very small protein made up of 3 amino acids: glycine, cysteine, and glutamate. Now, there's lots that's been written about glutathione. In fact, on my YouTube channel, I have made several videos dedicated strictly to glutathione and how to supplement glutathione. But the body makes glutathione internally from the 3 component amino acids, glycine, cysteine, and glutamate, every minute of every day, 24/7, 365. And if we don't make enough for our body's needs, because it does get used up faster when we have oxidative stress, then we're deficient and we're going to suffer from more oxidative stress. And in those situations, we need more glutathione. So that's one of the reasons that I am always stressing to my patients the importance of glutathione. And we talk about supplementing glutathione. We also talk about substituting the component amino acid cysteine in an over-the-counter supplement known as NAC. So that's just a little summary about the issue of oxidative stress, which again is very common. Most of those free radicals are actually generated internally from our own mitochondria when they get shifted into this mitochondrial cell danger response. It's also very important to try to reverse the mitochondrial cell danger response to practice self-calming. As it turns out, there's a lot of things we can do ourselves if we know what to do and practice it regularly that we can use to actually help calm the mitochondria, and often that will help restore them to their normal functioning state of oxidative metabolism, and we have a lot less oxidative stress. Whether that's praying or meditating or practicing breathing that's calming, or there are quite a few different formal programs like the Dynamic Neural Retraining System or the Gupta program, or the one that I prefer called VitalSide. That's Vital-Side program that was created here in Austin by one of my colleagues. So anyway, oxidative stress, having too many free radicals, causing the body to break down too quickly, like rusting, can be reversed by glutathione and by helping the mitochondria shift back into the state of normal function, not mitochondrial cell danger response, but a state of calm, and can be measured by keeping track of our heart rate variability and remembering that we normally want to have some level of heart rate variability, not necessarily high, but we don't want it to be abnormally low. We don't want to lack heart rate variability. That's a state that's consistent with us being in a place of oxidative stress. Well, I hope this has been helpful, and you can certainly learn more. I'm happy to consult with people. My practice is open, and I hope it's been helpful.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.